Sennex electrochemotherapy is used in the local treatment of cutaneous and subcutaneous tumors. A short OT procedure, it achieves better uptake of chemotherapeutic drugs. The sennex device used for electrochemotherapy is portable and easy to use. It can be assembled in just a few minutes. The electrochemotherapy procedure usually takes about 20 to 30 minutes. The doctor first marks the tumor or tumors to be treated. Major blood vessels and ribs are also marked if they are in the vicinity of the tumor. Ultrasound imaging can also be used to indicate major blood vessels. Photographs taken prior to the procedure are useful for analyzing therapy impact later. After disinfecting the tumor area, doctor injects appropriate quantity of chemotherapeutic drug either intratumorally or intravenously. Bleomycin and cisplatin are the recommended chemotherapeutic drugs for electrochemotherapy as per the European standard operating procedure. Cisplatin is recommended only for intratumoral administration. Bleomycin cannot be used if the patient has already exhausted his or her lifetime dose for bleomycin. It takes 8 minutes for the drug to reach the tumor when injected through IV. If injected intratumorally, this period is 30 seconds. Once the drug reaches the tumor, a 20 minutes window is available for treatment. After allowing the drug to reach its destination, local anesthesia is given at the tumor site. If the patient is very sensitive, some sedation can be administered. Doctor may also recommend general anesthesia. The sennex probe is disinfected prior to use. Electrodes are fitted into the probe. Additionally, a surgical glove or cover can be wound around the probe. Usually, 4 needle electrodes are attached to the probe, but if there is less space available for manuring, one can also use 2 electrodes. While using only true electrodes, make sure they're attached in positive and negative sockets to complete the electric circuit. Electrodes are positioned 5 mm away from the tumor area. Technician presses the foot pedal of the device to release electric impulses. The needle electrodes penetrate to a depth of 15 to 20 mm to deliver impulses to the tumor. Doctor works his way from the periphery to the center of the tumor. 8 impulses are released in every insertion. Several insertions may be required to cover the entire tumor. With every single insertion, the sennex screen displays a square waveform graph. The technician waits for the graph to stabilize. This indicates that the impulses have been delivered successfully. The electric field generated by these impulses envelopes the tumor cells. Electric impulses impact the cell membrane and increase its permeability transiently. This process is called electroporation. Electroporation allows easy uptake of the chemotherapeutic drug molecules. Once the impulses stop, cell membrane permeability drops. Chemotherapeutic drug gets trapped inside the cell. The effect of the drug amplifies. This leads to cell death. The procedure is complete when the doctor is satisfied that the entire tumor has received impulses. After treatment, the tumor may be covered or kept without dressing. Doctor may recommend antibiotics. If treatment is under local anesthesia, patient can go home after an observation period of few hours. It takes 2 days to see the first signs of improvement. It may take up to 4 weeks to see the total impact. The doctor may want to repeat the treatment for further improvement. For more details, you can log on to www.unmed.se.